The opinions expressed in the following program do not necessarily reflect those of Invisible Wounds or Wightman. Please be aware that the content of Fireside Chats with Deborah may contain sensitive subjects such as suicide, grief, violence, PTSD, and other mental health conditions. By discussing these subjects, we will decrease stigma, bring awareness, and hope. If you need support, please reach out to trusted contacts, family, friends, call your doctor, or go to the closest emergency department. Call helplines such as Boots on the Ground at 1-833-677-BOOT. We hope this series helps build self-confidence in you. On today's show, Dr. Stephen Jett, Clinical Psychologist, launch for first responders. This episode of Fireside Chats with Deborah is brought to you by the Ayrshire House in Elora, Ontario. Welcome to the Ayrshire House. Refined and exceptionally welcoming, the Ayrshire House offers first-class accommodations in the historic village of Elora, where the beauty of nature blends seamlessly with the sophisticated small-town charm. The Ayrshire House offers beautifully curated accommodations fronting on the main street of the charming village of Elora. Featuring sophisticated designs and modern amenities, our 9 elegantly furnished guest rooms and suites are housed in 3 properties situated all minutes from the elegant Elora Mill and Spa, and only steps from the historic downtown and its stylish restaurants, upscale boutiques, eclectic art galleries, craft brewery and distillery, and spectacular eco-adventures. Find out more at www.ayrshirehouse.com.
Today I'm very happy to introduce Dr. Jett. Dr. Jett comes from Guelph, and he has a business there which is very well known and well respected, and it's called Jett Psychological Services. So Dr. Jett, thanks again for joining us, and I wonder if you would start off by telling us a little about yourself.
Hi Deborah, it's great to be here. I'm a clinical psychologist and I own a practice in Guelph called Jett Psychological Services. Along with being a clinical psychologist, I'm a father, I'm an avid golfer. I didn't say I was a good golfer, I'm an avid golfer. And I'm a son, I'm a brother. The reason I mention these things is often when we talk to first responders, one of the things we encourage them to do is to identify and talk about the various roles in their lives. They're not just first responders, though that's often an important role for each person. They are also family members, musicians, etc.
Okay, wow, that's very positive. And thank you for sharing that about yourself. And thank you for doing the segue right into first responders, because yes, that's one of the reasons that we're here today. So my understanding is that you've got a new program, actually it's not that new, that you have been working on. It's called Launch, I believe, is that correct?
Right. We have a mental health training and wellness program for first responders. For the past 3 years, we've been developing it and pilot testing it. And I'm excited to talk about it today because, you know, we've put a lot of work in the program, number one, and so I want to share that. But I also want to let people know that it's having some positive effects for the first responders we're working with.
So why don't you begin by maybe giving a bit of history about why you started it. You know, why did you focus in on first responders?
We were getting a lot of calls from first responders. So just before the pandemic hit and in the early days of the pandemic, getting a lot of calls from first responders and their family members who were dealing with marriage and family problems, mental health diagnoses, depression, anxiety, post-traumatic stress disorder, addiction problems. And they were sometimes or often off work on a medical leave or stress leave. And what we talked about within our practice was we need to do more and we need to do more sooner. So we developed this program. It's really an upstream program. It's a help before you need it program so that we're working with first responders before the wheels fall off.
Oh, okay.
The inspiration was to help sooner and to help better. So we developed this program, and it's got a number of core components. The first component is an assessment component. We do a baseline assessment, and it's not a diagnostic assessment. The reason it's not a diagnostic assessment is we don't want to put people through hours and hours of testing. What we want to do is leverage their time and leverage what we know about mental health and first responder mental health to gather the most effective and efficient information we can to help people understand how they're doing in that moment and also how they might progress through the program.
So you actually then, you're doing a little bit of an assessment just to get a baseline.
That's right.
And then you're actually speaking with them and sharing what you perceive they might need.
Yes, we share the results with them. So the assessment has two parts. There's the gathering the information part that we do, and then there's also communicating back to them the results. We want people to know what it is we've learned about, their mental health, and also what we think they can benefit from with the program.
Okay.
And the report is also, it's really a cheerleading report too, because we're saying, good for you. You're looking after your mental health, you're making it a priority, and we're going to support you along the way.
So even the fact that they might have some struggles or challenges in life, the fact that they've reached out for help is, so positive. And I think that's one of the things it's very difficult. Although there's been a lot of changes, maybe administratively, and some support given to first responders, there's still that existing stigma.
There is.
That's great that you're being able to open some doors and letting people in.
Yeah.
So do you want to expand a little bit more? You said there's different components.
That's right. So the baseline assessment, and then there's what we call it our intervention phase. So the program itself is 3 months in duration, and if people choose to go beyond that, they can extend the program as well and get a number of the same features after the 3 months. So it's an online self-directed program, and so after the assessment we do the intervention component, which is online videos on topics that matter to first responders. So we have a video on sanctuary trauma. We have another video on how to communicate, how to cope and communicate, both at work and especially at home. We draw from some of the relationship research and what are some of the most effective communication styles and what are some problematic communication styles. And what we've learned over the years from our clinical work with first responders is that some of the problematic communication styles are more common, and and some of the factors related to that is the work that first responders do. So in some ways we're training folks on how to communicate more effectively, not just at work, but at home.
Right.
So that intervention component has has online videos that people can watch, and then we have what are called training exercises. So before the video, we basically introduce the topic through a series of open-ended questions to help people get familiar with topics like sanctuary trauma or hypervigilance. Then there's a video component. People watch the video, and the videos are about 20 to 30 minutes. We learned through our pilot testing that once we got to 45 minutes or an hour or beyond, that there were diminishing returns. People weren't watching the whole video. They weren't as engaged in it. So it's tight. The videos are tight, and after people watch the videos, there's another round of training exercises, which again are open-ended questions that people type their responses in, and that's the application phase. How do you take what you're learning in those videos and apply it to your life, both at work and at home?
So I have a question. So if I'm a first responder and I had the experience with sanctuary trauma, okay, really not happy, disappointed, hurt, angry with administration, whatever level that may be, and so they watch this video, that might churn up some feelings. How's that dealt with?
Yes.
Well, if it's not one-to-one, I guess is what I'm asking.
Sure. There are a few different ways that we do that, and maybe the best way to talk about how we respond when people are feeling distressed or if feelings churn up, as you say, is we have an ongoing wellness check. So we do a well-being rating every week. Oh. So if people are going through the material, going through the program and finding it churning up some feelings and they're becoming more upset, when they fill out their well-being rating scale every week, they can see how they're doing, but we can also see, as coordinators of the program and as the director, I can see if people start to dip in their well-being or their overall mental health. And so then we reach out. That's one of the other components. If we see people dip in their mental health, we reach out to them. We touch base by email or by phone. And in that communication, if one of the things that the launch participant and I discover during that conversation is that they need therapy, then folks get access to therapy within a week's time. So we provide streamlined access to care, because we know that one of the barriers to getting help is when anyone, a first responder or anyone, makes a call to an office and they've got to wait a number of months, they may not start therapy, or they may not even make the call. So in this situation, if you're part of the program, we're going to see you within a week's time if you need therapy.
So how long was that research component?
So we pilot tested the program twice over the course of 1.5 years. So the first pilot test was 3 months, and we worked with a local first responder group, and we learned a lot. Actually, let me back up. The first pilot test was internal individual therapy clients that were already clients at Jett Psychological Services. So they were already clients of ours, and they were first responders, fire, police, corrections, EMS, so a range of first responders. And that was a 3-month pilot. We learned plenty. We took their feedback to heart and made the program even better. And the second pilot was with a local first responder service. And we learned plenty from that too. So those pilots, and that pilot was 6 or 7 months. And one of the things we learned was the program going for 6 or 7 months in its full form is too long. At some point, people stopped engaging as highly. So we decided to cut the program back to 3 months and have people engaging, and we can talk later about what we're learning about the engagement numbers, but have people engage for that 3 months, and if they want to continue with the program beyond that, we offer them a few of those features, and they can continue on with what we call launch extension.
So what would be the next step then? I think you've described that. Where are you right now?
We're partnering with services and associations throughout the province. So yes, it's an exciting time for the program. You know, the vision of the program is to create a culture shift among first responders on how they relate to their mental health, not waiting until there's a crisis. So that's the vision. Let's not wait. Let's get to this earlier rather than later. And you know, the partnerships we're forming are going to not only help individual first responders, but I think it's also going to shift the culture of looking after your mental health within the first responder community.
May I ask a question about that partnership?
Sure.
Okay, so obviously I know different organizations across the province and across Canada, some of them.
Yeah.
So if they were interested in partnering with you or learning more about that, who would they speak to?
Well, they'd start with me. I mean, we have a very passionate and involved team of people who are working on this program, but they'd start just by reaching out to me. And whether we have the first meeting together or we invite other members of our team to be a part of it, we've talked with wellness coordinators, chiefs, association presidents. We've talked with a number of organizations about how to roll this out within their service.
Could you explain a little bit about the results that you found with the launch program?
Yes. Yeah, I'm excited to talk about the results. When we first developed the program, we thought we had something. Based on the years of clinical work that we've been doing with first responders, the program we developed we thought would be effective. And I guess I should say hoped too. We hoped and expected it would be effective. And then when we started looking at the results of the pilot tests, we were even more encouraged. There are probably 3 main findings that are worth commenting on. The first is that people are improving in their mental health by being involved in the program. So 75% of the people who went through the program met their mental health targets as they made their way through. So that is similar or better than typical individual therapy. So what we have here is a program that is therapeutic, but not necessarily therapy. So which is good if people have some stigma around going into therapy. If they can be a part of this online self-directed program and get therapeutic benefit that's similar to therapy, that's what we're looking for. We're looking to bring in as many people as we can, even people who aren't necessarily predisposed to wanting to do individual therapy. So one of the other findings is that people are engaging in the program. So most online programs have what I would say average levels of involvement. So engagement levels range around 33%. And our engagement is between 50 and 60%. And if we look at, I'm going to bore you here, if we look at completion rates of the program for online programs, our completion rate is 6 or 7 times what the actual average is for online programs. So people are completing our program and they're engaging in it in far higher numbers than exist in most other online programs. So I think there are a few reasons for that. We have, the platform we use is gamified, meaning it is designed to sort of connect people with the material and keep them engaged with it. We also have topics that really matter to first responders. This is a curated group of topics that we have learned over the last 2 years through doing the pilot testing, what really matters to people and what they really engage with. And we have a care coordinator who is basically tapping people on the shoulder when they fall off. If they don't engage with the program, she's tapping them on the shoulder to sort of keep them engaged. Yeah. And that really matters.
Really provide the support to them as they go through.
For sure.
Oh, that's a great program.
Yes. One other thing I want to mention, which we didn't know at the time was going to be one of the main results of the program, but one of the things we're seeing is the safety net component of this program, this notion that if people fall off, this program is going to help to catch them and ideally serve as a bit of a trampoline to help them bounce back. What we found is that 80% of the people who've gone through the pilot have, how do I say this, needed a phone call or an email to touch base because their well-being scores had dipped. So 80% of the people who've gone through the pilot test have needed that sort of check-in. More often than not, what we hear from people is, I had a tough call, or so there's some stress at home. And more often than not, people say, but I've got something to look forward to, I'm using my tools, I've got a therapy appointment with my therapist. Basically, they're saying, I'm okay, but I appreciate you looking out and reaching out. Every once in a while, what we found was about 10 or 20% of the time, people will say, I'm really struggling and I could use some therapy. So in those cases, we're saying, okay, we'll get you in. We will see you this Thursday. Right. We will see you this Thursday. And what's happening is we're identifying those folks, we're reaching out to them, and it is serving as a bit of a springboard. So that's what we see when we look at the wellness rating scores after we've had this point of contact, is that their well-being scores start to rise again.
So the one question I guess I have is, how many people did you have in the cohort?
So the first pilot was 8 members, the second pilot was 20 members. And since the pilot's wrapped up in the fall, we've had folks go through the program, more folks go through the program. We have individuals going through the program, and with the partnerships coming up, what we expect is we're going to have groups of people going through the program. But the folks who've gone through the program since the pilot, the results are mirroring what we saw in the pilot. Very positive results for people going through. And although this is a help before you need it program, what we found is that the folks who were entering the program at fairly high levels of distress are also benefiting. It's not just people who are doing pretty well who are benefiting from the program. Folks who are going through some degree of struggle are also benefiting from the program.
Is there any hesitation that you're aware of that still exists for people once they get into the program, I guess?
I think what usually happens from the moment people call our office or email us, we're trying to engage them. We're saying, good for you for reaching out. We think this program is a good fit for you, and here's why. And from the early moments of their contact, we're engaging them. And what that means is they see us as someone they can trust, and they see us as someone who knows their stuff.
Right. Okay.
And so the hesitation, if there is any, it doesn't exist much beyond those first couple contacts, because they feel like, okay, this is something that can really help, and these people know their stuff.
And I think that's really important. You know, as we know, there's a lot of clinicians out there, especially since COVID, and a lot of them identify that they are experienced working with trauma and experienced working with first responders. And I strongly encourage first responders to do the research, even though it's a bit of a pain prior to that, or ask questions when they reach out for therapy, because there are definitely organizations who are much more experienced and much more effective. And you, obviously, with your organization, have a very good reputation, as I said. So kudos to you guys.
Thank you. Thank you. Yeah, when people reach out, it's important that they're met with someone who knows the field, knows what it means to do not just trauma-informed work, but work that is relevant for first responders, because they're not only dealing with trauma, they're also dealing with sometimes sanctuary trauma or addiction issues, and so you want a place who knows the range of difficulties that first responders can experience, and also the avenues to getting better.
So as we know, with a lot of first responders, the organizations, the departments of services, they're municipally funded, right? And so therefore funding is an issue. Have you addressed that with municipalities, or have you found that at all? Or am I just off in space?
No, I think there are potential barriers there for sure. We've talked with a number of services, and what we're often hearing is, I really like what you're doing. This makes a lot of sense. I'm glad you created it. We hear that over and over again. And the next step, of course, is actions over words, right? If there are organizations who are saying to us, we like your program, launch makes a lot of sense for our membership, the next step is taking action and finding room in the budget, making room in the budget to look after the mental health of the membership. And I know that there are barriers within organizations to try to find that funding, and so I don't want to say that folks aren't trying to make that happen, but I think part of it is building that trusting relationship so that organizations can look to launch as a effective way of looking after their members. And I think the more those relationships build, the easier it's going to be for that funding to come through and for the program to be even more widespread.
Yeah, I think there's, I know in rural Ontario, for example, because funding is so tight, that on occasion they do the minimal checkbox things, and I don't know whether or not that really covers them if in fact they have an employee that starts to struggle. And the one thing that I don't know if people really realize is that if you don't invest, this is me getting pumped up, if you don't invest in the mental wellness of your employees from the get-go, from when they're young or on the department, and then 5 years, 2 years, 10 years later, you've got a very ill employee. That takes man hours, that costs for WSIB claims. There's a lot of financial cost to one employee. And then there's a thing about how it impacts the organization. Because you've got, say it's with the police department, if you have one person off, it affects the whole group they're working with. The same with firefighters and things like that. So
there's a clinical case for launch, right? There is a case to be made for catching problems early and providing people with the sort of support and direction they need before the wheels fall off. There's a clinical case, to be sure, which is why we created the program. There's also a business case. And the leaders within first responder organizations, if they're not aware of the business case and the dollars they would save through a program like Launch, if they're not aware of it today, they will be next year and the year after. Because the folks going off work right now, I think it's about 15% of first responders are off work on some sort of leave. And if that's the case, then that is a financial impact to services.
Yeah. And what I find is that because I have relationships with a lot of administrators or chiefs or deputy chiefs or whatever, is that they're cognizant of the problem, right? But because they're funded through a municipality, they may not be. Or because the municipality is granted, they have X amount of things to their tax dollars that are brought in.
Yeah.
And yeah, it's a real difficult problem, but you know, my hope is that there's just acknowledging, I guess, that with administration, sometimes they would really like to have the service,
yeah,
but their hands are tied.
Yes.
And so it needs to go up to the next level.
That's right. And we're having those conversations right now.
Oh, okay.
Yeah.
Good for you.
Yeah.
Thank you.
Thank you.
Is there anything else that you would like to talk about, maybe separate from first responders? First responders, yes. Family members.
One of the things that we're finding is really important, both when we did our pilot testing and as we've been rolling out the program for the last now 3 years, is that first responders are not only struggling sometimes at work, they are struggling at home. And this program is not only a first responder content, first responder mental health issues program. It really is. We understand that being a first responder is one of your roles in life. You have other roles, and we know that there are other things that can serve as speed bumps to your mental health, including things at home. So the program involves things like, how do you communicate about work at home? How do you deal with issues of burnout? What are some effective ways to improve your sleep? How do you deal with the 4 horsemen of communication? There's great research on communication and relationships, and there's something called the 4 horsemen. So the 4 most problematic forms of communication. How can you identify those in your important relationships, and how can you use other skills to communicate more effectively and not just stabilize your relationships, but have them thriving? So I think that's important. I'm glad you brought up family members, because it's not just the experience as a trauma-exposed professional that can lead someone to struggle. It can be when things happen at home.
So I just would like the viewers to know that your business, yes, call it a business, does the Launch program. It offers it.
Yes.
And that's for first responders. But you also do counseling for civilians, which would include
Sure.
the family members.
Certainly we do.
First responders and
Certainly
others.
we do.
Yes.
We have for years and years and years. We'll continue to. There are a number of ways to support families, and it's not only supporting the first responder. It also is supporting other members of that family who have their own burdens and stresses and difficulties that may or may not be tied to that first responder's work necessarily. So yeah, we do plenty of that. Couples therapy, we work with adolescents, and we certainly work with partners or spouses of first responders.
Okay. Yeah, I think that's important to know. Well, thank you very much for coming in today and for sharing that information. Very enlightening for me, and I'm glad to know that it's up, and wish you the very best.
Thanks,
with
Deb.
it.
Thank
And
you.
it'll be the first responders and their families that definitely benefit from it.
Great. Thank you, Deborah. I appreciate you having me.
Invisible Wounds will host events promoting mental wellness to first responders, their families, and civilians. To find out more, please visit our website at invisible-wounds.ca.